Arthritis is a leading cause of disability in our country. In fact, there are more than 100 different kinds of arthritis. This is Arthritis Awareness Month. Health specialist Leah Sarich here this morning talking about rheumatoid arthritis and why it's crucial to get an early diagnosis.
It really is, particularly in this case. So we're talking about 1 in about every 100 Canadians. They have
1%.
Yeah, exactly. They've got rheumatoid arthritis. So this can happen at any age. So it's not just, for senior citizens, the way we sometimes think of arthritis, but it's most commonly diagnosed with rheumatoid arthritis between the ages of 25 and 50. So really right in the prime of your life. This is Tasha Guest. She was diagnosed with rheumatoid arthritis at age 36. She had 3 small children when the youngest was just 3. And you can see her there. She was just checking her phone, something we all do every day, something she can do now but would have been impossible 3 years ago. Her symptoms came on very quickly. One night her knees were sore going down the stairs, her neck was sore all night, she didn't sleep well, and after a few days she was really swollen all over.
It literally impacted every aspect of my daily life. So I had to teach my 9-year-old son how to start the car for me because I literally couldn't turn the key on the ignition. My 7-year-old daughter at the time had to learn how to groom me and bathe me, help me get dressed because I couldn't do those things by myself. It literally impacted everything. I had a 3.5-year-old at the time at home, and she would lay down with me because mommy had to nap 2 or 3 times a day.
Yeah, so she had some very bad fatigue as well. And what she's doing right here, putting on her rings, that's something she just couldn't do for about 2 years.
Wow.
And she couldn't play the sports that she enjoyed. She couldn't take her kids on field trips. But of course, these are all things that she can do now. In fact, she's back to playing soccer competitively.
Great.
And the main reason is because Tasha got her diagnosis and then onto her treatment very quickly, within about actually 3 months. So she currently has no permanent joint damage. And that's really what we're trying to do here. So it has, and that's often not the case with RA because the diagnosis for some people are coming later. But if you can get it early and avoid that permanent joint damage, then this is what specialists are really wanting to get out there, because you see, if you do it sooner rather than later, you're avoiding that permanent joint pain, permanent disability, and of course pain.
It's very important that they be seen early and then we get them on treatment early, because that changes their outcome forever. Studies showing that even a delay of 3 to 4 months may change X-ray progression, and X-rays predict ultimate disability. So we want to see people early and get them on disease-modifying drugs. So those are not just your Advil or your Aleve, it's getting you on the disease-modifying drugs to try to get the disease in remission or low disease activity.
So just a few months can make a huge difference. So in fact, I had Dr. Mosher check out my hands because I've had a little stiffness in my hands, and that's in fact one of the telltale signs. There's a little stiffness in the joints of your hands and the small joints of your hands, or in your feet. That's often where rheumatoid arthritis starts. So hands and feet, stiffness and swelling. I'm fine, as it turns out, but she does think there might even be a little bit of osteoarthritis in that one finger. But of course, that's another story.
Okay.
But bottom line is if you're concerned, you want to see your doctor as soon as possible so you can get a diagnosis and onto that treatment as soon as possible. And in fact, there are many more treatment options now than even 5 years ago. So it's just a matter of finding the right one for you.
When you see your doctor and you get your referral, what happens after that?
Well, what's wonderful about here in Calgary is that it's a multidisciplinary approach to care. So what that means is you're referred to the rheumatology clinic. Patients are seen there by a doctor, a rheumatologist, and then a nurse and a physiotherapist and a social worker and a pharmacist. Because of course, you can imagine how stressful it would be to be living with this kind of pain and potentially disability right at the prime of your life. So with this kind of multidisciplinary approach there, they're finding it works really, really well for patients. Not only to do better in their lives, but to stay on their medications and be compliant with their medications, which really helps, of course, for the long term.
There you go.
There you go.
All this information is going to be on your blog.
All of it's on my blog, you bet.
BreakfastTelevision.ca. That's where you can find it. Thank you, Leah.
You're very welcome.
Stuff.